Hello students, welcome to the AY tutorials. Today we are going to study OTC medicines. Over the counter, that is OTC drugs. OTC drugs are those drugs which are safe and effective for the use by the general public without a doctor's prescription. This is the definition of OTC drugs, that it includes those drugs which are very safe and effective and we can use it without a doctor's prescription. It is also called as prescription controlled drugs. These drugs are the non-prescription or over-the-counter drugs. So these are also known as non-prescription drugs. These have little significant pharmacological activity and therefore the physician need not to be very much concerned about their use by the patient themselves. It is used primarily for the symptomatic relief and not as substitutes for prescription drugs. So if we are having any body ache like headache, muscle pain, then we are usually having the painkillers and those comes under these OTC drugs. Then what is the significance of these OTC drugs? They are comparatively cheaper. Chemist himself may prescribe OTC. Consumers are able to self-diagnose, self-treat, self-manage. OTC considered as the time-saving medication. Some patients do not want to spend much time at physician's clinic. Lesser number of side effects compared to the prescription medicines. So as we all know that if we are having the certain conditions which are not really that much of bad, so that we should have to visit the hospital and have a prescription, so at that time we can go to the chemist and have this kind of medicines. They include NSAIDs, that is non-steroidal anti-inflammatory drugs. As we all know that they are known as painkillers by the people. Drugs used by the Indians. Over the counter drug products account for 55% of drugs used by the Indians, whereas prescription drugs account for 45%. The types of OTC medications. There are several types of OTC medications which includes analgesics, antibiotics, some cough suppressants, anti-acne products, NSAIDs, antiseptics, some diagnostic agents. Diagnostic agents means if, as we all know that if we are pregnant, then we use Preganews and all that kind of products. Then antacids, antifungals, antihistamines and smoking cessation drugs. Smoking cessation drug means those drugs like nicotine patch or nicotine lozenges are there. That kind of drugs are OTC medications. Rules for the proper use of OTC drugs. Always know what you are taking, know the effects, read the head and warnings and cautions. Don't use anything for more than 1 to 2 weeks. Be particularly cautious if also taking prescription drugs. If you have questions, then ask to the pharmacist. If you don't need it, don't use it. So, the patient should remember that these are not prescription drugs, so you should not take it for more than 2 weeks. And general people, they are not aware about the drug interactions or drug food interactions, so it should be taken into consideration that if you are having any prescription drug and you are taking it with these non-prescription drugs, that is OTC medicines, then there may be a certain interactions like drug interactions are there. Then care must be taken. If you having any symptoms like that, then you should visit to the hospital. Misuse and abuse of OTC drugs. Physical dependence, psychological dependence, non-prescription products that can be severely habit-forming, decongestants, laxatives, antihistamines, sleep aids, antacids, and ephedrine. Only 16% read the entire product label. If they read them, they do not follow the directions on the label. Abuse is most common in adolescents aged 10 to 17 years. Adolescents are 18% times more likely to die from the OTC overdose than the illicit drug dose overdose. See, nowadays, no, there are a lot of people who are having OTC antibiotics and they are not known about the proper dose and all. And so after a certain age they develop very bad resistance to the antibiotics, and I have seen some people die because of this problem. And also people consistently use OTC NSAIDs, that is non-steroidal anti-inflammatory drug, which are also known as painkillers, and as the side effect of that they are having kidney failures even at the age of 30 to 40. So care should be taken while taking the OTC medicines, and this kind of study should be also there, that what kind of medicines we are having, so they are really necessary or not. And likewise, rational use of OTC drugs. Rational use of medicines refers to the correct, proper, and appropriate use of medicines. Rational use requires that patients receive the appropriate medicine in a proper dose for an adequate period of time and at the lowest cost. Analgesics. Pain relief medicines, also known as analgesics and painkillers, are regulated by the Food and Drug Administration, that is FDA. Some analgesics, including opioid analgesics, act on the body's peripheral and central nervous system to block or decrease the sensitivity to pain. Others act by inhibiting the formation of certain chemicals in the body, and these relieve the minor aches and pains associated with the conditions such as headache, fever, colds, flu, arthritis, toothaches, and menstrual cramps. These are basically two types of OTC painkillers: acetaminophen and non-steroidal anti-inflammatory drugs, that is NSAIDs. Acetaminophen is an active ingredient found in more than 6,000 TC and prescription medicines, including the pain relievers, cough suppressants, and also the cold medications. NSAIDs are common medications used to relieve fever and minor aches and pains. They include aspirin, naproxen, ibuprofen, as well as many medicines taken for the colds, sinus pressure, and allergies. They act by inhibiting an enzyme that helps to make a specific chemicals. Use as directed. Pain medications are safe and effective when used as directed. However, misuse of these products can be extremely harmful and even deadly. Consumers who take pain relief medication must follow their healthcare professionals' instructions carefully. If a measuring tool is provided with your medicine, use it as directed. Do not change the dose of your pain relief medications without talking to your doctor first. So, people are not aware about the side effects of these NSAIDs, like coxibs are there, like celecoxib, etoricoxib. They are having the heart attack as its side effect, and in some countries it is banned because of this side effect. Then indomethacin, it is also contraindicated in the machine operators. Some pyrazolone derivatives are there, like phenylbutazone, oxyphenbutazone, profenazone. They increases the bone marrow suppression. So the care should be taken while having this. Then nimesulide, nimesulide is also banned due to the fulminant hepatic failure. Then it is having the high risk of heart attack also. And we all know that paracetamol, it is also having the various side effects like liver failure. Special patient groups. Talk with your doctor before taking any NSAID if you are over the age of 60, if you are pregnant or nursing, have 3 or more drinks of alcohol every day, have bleeding problems, have liver or kidney diseases, have heart attack or heart related problems, take a medicine to thin the blood such as warfarin or coumarin derivatives, take a medicine for high blood pressure. Children and teenagers who are recovering from the viral infections such as flu or chickenpox should not take aspirin. It has been linked to the Ray's syndrome, a serious but rare condition that can result in brain and kidney liver damage. Naproxen sodium is not recommended for children under 2. Ibuprofen is considered safe for children up to the 6 months and older in the right dose. Special patient groups. Many patient groups may be particularly sustainable to adverse events that are caused by the OTC products, which includes children's, women who are pregnant or breastfeeding, then geriatric patients, then people taking prescription drugs, and people having health problems like liver failure or kidney failure. OTC medications are safe but not risk free. As with all the medications, there can be risk with the use. The risk of OTC use include delay in seeking medical advice for serious illnesses, risk of drug, herbal or dietary supplement interactions, risk of adverse events, and potential for dependence, misuse, and abuse of the medications. We have uploaded this video for the educational purpose as well as to give some information as the pharmacist to the general people, as these drugs can lead to deadly health problems. So if you like this video, please like, share and subscribe to the AY tutorials. Thank you.